Hey everyone, welcome back for another episode of Physio Show. Today we are talking about shoulder impingement, that pain when you reach overhead that just grabs you. Oftentimes that's due to dynamic instability of the glenohumeral joint or that shoulder joint, which places increased strain through that rotator cuff. So today we're going to be showing you quick and easy drills that you can do anywhere to help reestablish dynamic stability of that glenohumeral joint so reaching overhead is painless. My favorite way to reestablish stability is to start with static exercises, because sometimes with movement, it gets too complicated and we can't control that joint. And a great way to start is against a wall, what we call a closed kinetic chain exercise, so that we can minimize all of the variables of movement and really focus on establishing stability at the glenohumeral joint. But before we get started, let's understand the function of the rotator cuff so we understand the connection with the exercises. So the shoulder is a ball and socket joint, which pivots in multiple planes, has a lot of movement, which is good for the function of the shoulder. But what can happen is that humeral head that usually sits in the center of that joint has a lot more movement than normal when that rotator cuff isn't functioning properly. And that can result in increased translation forward or high, which places a lot more strain through the rotator cuff. So ultimately the purpose of our exercises is to reestablish that humeral head's ability to stay centered in that joint so that it doesn't translate excessively, so we'll have optimal function of the muscles and reduce the strain through all of the tissues, including the rotator cuff, with dynamic movement. So one of my favorite starting points for my patients who have trouble with the centering action of that humeral head in the joint is using a wall. This is called the closed kinetic chain exercise, where our hands are against a firm surface, and this helps minimize all the variables of dynamic movement, which makes stability much more complicated. So start here first, get the sensation of stability established, and then we can progress to more complicated exercises. So to begin, place both hands on the wall. And what we're going to do, it's a very, very minute movement, but we're going to be focusing on getting this humeral head recentered in the joint and engaging this posterior rotator cuff, whose role is to pull back that humeral head so it's not translating excessively forward or superior upwards. Okay? So hands on the wall. And watch this here. I'm going to put my hand here just so you can visualize it. And what I'm focusing on is recentering that humeral head back. It's a very subtle motion, and relax, and I'm going to engage, and it's going to relocate and center along that joint, and we're going to hold for a count of 3 to 5 seconds. And this is going to take a lot of cognitive effort initially, especially if you've been dealing with a chronic shoulder pain or just had a traumatic shoulder injury. Now, one thing you don't want to be doing is pinching the shoulders. I know a lot of rotator cuff rehab, you're going to be cued to squeeze the shoulders, squeeze the shoulders. We don't want to engage the shoulders for this because this is a glenohumeral stability focus, not the scapula. The scapula has other functions. We want the rotator cuff's function engaged here, which is to recenter that joint. So we don't want to get the scapula going as well. That's probably going to be one of the compensations that a lot of people will do. They're going to want to squeeze the shoulder back with this. That shoulder blade stays neutral, relaxed, and we're focused on just that humeral head recentering back, which is engaging this posterior rotator cuff, which is the function to prevent it from translating too far forward. All right? So we're going to do a lot of reps of this just to get it down pat, and we're going over for quality though over quantity. So if your form starts to break down, rest, let the muscle recover, and then re-engage the exercise. So again, very subtle motion. We're going to hold for 3 to 5 seconds and repeat. I recommend usually around 2 sets of 15 to 20 reps. Low load exercise, but we want that repetitions to develop this motor pattern to progress to more complex exercises. So once you have that static exercise down pat, you're able to center that glenohumeral joint with high repetitions and not excessive fatigue. Now let's move on to a little bit more dynamic and functional movement pattern where we're actually going to be reaching overhead. But let's walk before we run. So we're going to be utilizing the wall. So it's a little bit of a closed kinetic chain exercise still, giving ourselves some added stability. So it's not too complicated, where we can still focus on the quality of the stability of the shoulder. So what we're going to be doing is using a towel. It's a typical wall slide, But this wall slide will be enhanced with the focus of the stability of the shoulder, and we're going to be more purposeful with it. So we're going to take that towel, we're going to place our hand on it. Before we even move though, we're going to be engaging that centering action of the glenohumeral joint. So we're going to translate slightly back. Again, we're not pinching our shoulders. We're focused at the humeral head here. We're going to relocate here. Now, the trick to this is maintaining this position. Don't lose this. This is the focus. As we then reach overhead and then back down slow. And so I'm going to be ignoring my hand and arm. I'm focusing right at that joint and making sure that I don't lose that stability there and disengage that rotator cuff. I want to keep that rotator cuff engaged throughout the whole motion. So you're going to notice where my position is here. If I let go, it comes forward. All right, so I want to keep it centered, up, and then back. And I still should be able to move pretty fluidly while also maintaining that centering action at that joint. And you're going to feel this fatigue back here because that's that rotator cuff muscle maintaining that stability of the shoulder with movement, which is its functional role. And the reason why you get that pinching sensation when reaching overhead is because you lose that function of that infraspinatus and supraspinatus, the rotator cuff. So if we reach overhead, there's excessive strain on the tendons there. So this is a great way to reestablish that dynamic stability of that shoulder without overwhelming it with weights. So once we've gone through the progressions of static at the wall, dynamic at the wall with good stability, now let's introduce what we call open chain exercises, which is the functional role of the shoulder, where we're not having any stability at the hands. It's now an open chain exercise where we're going to have to require that rotator cuff to stabilize that humeral head as we reach overhead. But again, I like to walk before we run to really emphasize the quality of the movement, make sure there's no breakdown of the movement pattern so that we can really reestablish stability. So one of my next favorite exercises in this progression is the back against the wall. This is going to just stabilize your back and give you a little bit more postural stability. And what we're going to be doing is reaching overhead, but what we call a short lever position. So my elbow is going to be bent. Long lever would be forward, so that's a progression from this. So short lever to start. And throughout this whole motion, I'm focused on keeping that humeral head recentered in the joint, preventing it from translating forward or up. All right, so just keep it centered without restricted movement. Keep that rotator cuff engaged as I slowly go up and down. Now, as you get a hang of this, and you can do high reps without excessive fatigue or loss of form, that's when you want to introduce a long lever exercise, which is as simply as just straightening this arm out, center that humeral head here, and now we're raising up overhead, maintaining that stability of that glenohumeral joint throughout the motion. And then once that becomes easy, step away from the wall. All right, this is going to increase postural demand on our shoulder, which is good and functional. We want to work up to this and make sure there's no breakdown in form though. Same thing, center the humeral head, and we're reaching overhead. So once we can go through all of these progressions without increased pain, good quality, and without excessive fatigue, it is now time to add some load. But again, quality over quantity to begin with, making sure that when we add load, we do not lose that dynamic stability of the glenohumeral joint, otherwise we're defeating the purpose. So what we're going to be using is a resistance band for this. So you're going to anchor it against an object like a door or a pole. We're going to take the band, making sure it's really light to start with because this exercise is very fatiguing. You do not want to overload this exercise. Quality over quantity. So what we're going to do is elevate our shoulder to about 90 degrees. Our elbow is bent. Before we even move, we're going to center that humeral head in the joint. Maintain this throughout. We're going to rotate up. This is going to engage our posterior rotator cuff really nicely. Now notice that I'm able to maintain my elbow at 90 degrees and it's not deviating forward. If it's deviating forward, that likely indicates that you have too much tension on the band. Move forward a little bit or drop the band resistance down because we want to maintain form throughout this exercise without losing that centering action at that humeral head. So once in position, we're going to be monitoring this position of the humeral head. We're going to be pressing overhead and then back down, all while keeping an eye on our positioning of that shoulder joint This is an excellent way to load that rotator cuff with overhead movements. Slow and controlled. Keep that humeral head centered. Going about 2 sets of 10 to 15 reps. You're going to feel a really good burn with this one. And once your form starts to break down due to fatigue, stop and rest, let the muscle recover, and then continue on. Now that's quite a high level exercise, and it takes a lot of motor control and stability of that shoulder to perform properly. If you felt like it was too intense, there are other ways to bridge the gap, so to speak, so that you can build up to it. The regression from that shoulder press would be simply just keeping that humeral head centered, elevated like this, and performing external rotation without the press. Now, if that's also too hard, you can go down, turn so that you're perpendicular with the band, center that humeral head, and perform a standard external rotation that you will typically see with rotator cuff rehab. But keeping that humeral head centered, I think that gets lost a lot of times in rehab where this shoulder just dumps forward. Keep that humeral head centered, again, not squeezing the shoulder blades back, keep those neutral, but be paying attention of that centering action of the humeral head as we rotate. So those are just some examples of how to build up to that shoulder press with load, which can be a little bit of a leap from just simply region overhead. So take your time, build up, build the endurance, build the dynamic stability, and ensure the quality of the movement before progressing. Well, I hope you enjoyed this episode of Physio Show focusing on restoring dynamic stability of that glenohumeral joint so that you can reach overhead without pain. If you enjoyed the video, make sure to give it a like. It really helps the channel spread, help more people. And don't forget to subscribe so you can stay up to date about your body, how it works, and what it needs to keep moving.